One of the first double lung transplants with two patients that had COVID-19 happened in Illinois. The procedure was done at Northwestern University. Diane Patthew shares more of those details.
It's another groundbreaking surgery. Two patients, both with COVID-19. One recovered, one did not. That patient's symptoms got so bad, he needed a double lung transplant. Little did he know that was coming from a patient who just recovered from the virus.
We think it's an important milestone because, as of yesterday, there were over 30 million cases previously being diagnosed with COVID. And if we exclude those patients from organ donation and lung organ donation, there'll be a substantial gap in our supply demand.
The transplant recipient is an Illinois man in his 60s, a healthcare worker, diagnosed with COVID-19 back in May of 2020. He suffered permanent lung damage. After spending 1 week on a lung transplant waitlist, he received the life-saving double lung transplant procedure, a 10-hour surgery, in February, becoming one of the first known COVID-19 survivors in the U.S. to receive lungs from a donor who recovered from the virus.
So as we are seeing more and more patients who've had COVID require lung transplant, it's going to stress the system. There'll be more an increased need for lungs. So we need to be creative. We need to make sure that we maximize our donor pool.
The donor only had mild symptoms and died from an unrelated accidental death. Northwestern medicine surgeons have completed 14 double lung transplants on COVID-19 survivors, the most performed at any hospital in the world.
That was Diane Patthew reporting.